President Trump's Secretary of Health and Human Services continues to make headlines, most recently right here in Tennessee. Thanks for joining us. I'm Latricia Thomas.
And I'm Josh Rowe. Robert F. Kennedy Jr. spoke in Nashville today at the RX and Illicit Drug Summit. Kennedy focused on his own journey with addiction and said changes need to be made to help adults and children avoid addictive drugs.
Kennedy has drawn heavy criticism from scientists and public health experts. During his speech today, several protesters stood up and shouted things like, "Believe science."
But he said, that
Kennedy's appearance comes after his controversial comments about the possible causes of autism and a new program to study it. The National Institute of Health says they plan to develop a national autism registry at the direction of Kennedy and the Trump administration.
News Channel 9's Ja'Kai Spikes joins us now to tell us more about what this might mean for families whose loved ones live with autism. Ja'Kai.
Latricia and Josh, major concerns are coming from the autism advocates near us as they worry about their personal medical records being compromised.
is we are going to have updated real-time data so that people can look at this.
This announcement by Health and Human Services Secretary Robert F. Kennedy Jr.
We don't wait 2 years to react to a measles epidemic, and we should not, or any kind of infectious disease. We shouldn't have to do that for diabetes or autism.
Is now causing questions about how that data will be gathered and used. National Institute of Health Director Dr. Jay Batra said in a council meeting for the agency this week that the data would come from pharmacies, medical records, and even wearable devices like smartwatches. He also said this.
The platform will accelerate research and create new opportunities for cross-agency use of data in real-time health monitoring, developing national disease registries, including a new one for autism.
But when we reached out to the Department of Health and Human Services to see if patients could opt out from sharing their medical information, they told us we are not creating an autism registry. The real-world data platform will link existing data sets to support research into causes of autism and insights into improved treatment strategies.
First part that strikes me is the insulting way that he's talking about curing someone who, my friends are proud of their autism, they're proud of being autistic, and so right there makes me not trust this person.
Even though there are still questions about data collection and use, there are privacy concerns.
This thing is breaking the trust of individuals who have an expectation of privacy of their medical information. That is across the boards what medical and places do and clinics do. So this just seems like an immediate violation of privacy.
There are state-of-the-art protections to make sure that although linkages across the data sets will be permitted inside the platform, that these linkages do not in any way threaten or the confidentiality of patients.
Robert F. Kennedy Jr. says he wants to have these study results released by September. Latricia.
Ja'Kai, thank you. The NIH's director says this new data platform will record information from environmental data, air pollution, and environmental toxins in an attempt to find a possible cause for autism. The CDC says the development of autism comes from a range of known and unknown sources, not solely from a person's environment.